We are still on the topic of image intensifiers for this lesson. I will be discussing two major topics for the next few minutes. It will be on multi-field image intensifiers and the application of magnification. Multi-field image intensifiers allows the technologist to choose multiple size fields of views. For myself, I see this being applied in OR procedures most often. The doctor will often ask the technologist to mag an image. The technologist is actually choosing a smaller field size. When describing different types of image intensifiers, you will refer to the size of the input phosphor. These can range anywhere from 25 centimeters to 7 centimeters. These measurements are describing the diameter of the input phosphor, which is your field of view. Field of view is the area which is visible. A small field of view will reveal less than a large field of view. You may be wondering why not always have a large field of view if that is the case. There are advantages and disadvantages to both. If you want to see more anatomy without having to move the fluoroscopic machine as much, it is better to use the large field of view. If you want to see small detail, it is better to use a small field of view. However, you cannot see anatomy that is outside of the field of view. You're not going to find image intensifiers with only a single field of view. Most of them are either dual or tri-field. Dual fields will have 2 FOV selections and tri-fields contain 3 FOV selections. A 25-17-7 image intensifier is commonly seen in your fluoroscopic equipment for the C-arm or fluor room. These 3 numbers measured in centimeters describe the sizes of the input phosphor. The 25 centimeter setting will have the largest field of view and least amount of magnification, while the 7 centimeter is the opposite. It will have the greatest magnification with the smallest field of view. Now let's talk about magnification. A lot of times when we imagine something being magnified, we think the image is being made larger. That is not true in the case of imaging. When an image is magged, the technologist is selecting a smaller FOV, zooming in on the smaller portion of a larger part. Now if you remember the formula for minification, by selecting a small FOV, the ratio of minification gain is decreased. Decreased minification leads to a dimmer image, but there is higher spatial resolution because it still contains the same amount of pixels in a smaller area as opposed to a larger. This increases image detail. Decreased minification gain is compensated by ABC, which is short for automatic brightness control. The ABC will up the tube current, which increases your MA, but this also causes increased patient exposure by as much as 2 to 3 times. You can actually calculate this by taking the ratio of the larger area squared over the smaller area squared. This is where I will conclude the lesson.